Hi guys, and welcome to today's video. As you can see by the title, this is the long-awaited, long-waited for, took me a long time to film, it's finally here, and it's a really long video. The interview with my mom, who is a who is a nurse practitioner in the NICU. This video has been so highly requested for so long. You guys have sent in questions for a long time. I meant to film it months ago before I moved into my apartment and it just didn't happen. Just so you know, my mom does not do interviews. She doesn't like being on camera. This is not her thing. So I would really appreciate it if you were kind to her. I really hope you guys enjoy the video. I loved filming it. It was really fun getting to film with my mom and ask her all of your questions. If your question wasn't answered or you have more questions, feel free to leave them in the comments below. Otherwise, I think we should just get on into the video. Okay, the first one's how long have you been an NNP?
For 23 years.
Long time.
Yeah.
Did you specialize, or are you a family nurse practitioner working as a neonatal nurse practitioner?
Neonatal nurse practitioner.
Okay.
Yeah, you wouldn't be able to probably find a family nurse practitioner working in this role.
Okay.
I wouldn't say never, but their clinical preparation is just
Not
different.
the same.
No, they are primary care focused and don't have the number of hours
So
in
like
a
where
clinical program.
Okay, where would a family nurse practitioner work?
In an outpatient clinic. We have here PAs and nurse practitioners that aren't neonatal that work only in the newborn nursery.
Mm-hmm.
So you might find them in a newborn nursery, but that's pure wellness.
What does day-to-day look like for you at work? And then like another question that someone else that's kind of similar was, how does the autonomy feel when you're working with patients who can't tell you what's wrong, parentheses, babies?
It depends on the setting. So I have more than one hospital I work at. One, my main site is what we consider level 2. That's typically a smaller nursery. It's a nursery that takes babies that are born at 32 weeks and above. They're typically not that critical of a patient. So if they need long-term on a ventilator or really chronic complicated diagnosis, then they're not going to stay in a level 2. So in that setting, if we have patients, then I go in and I get an update from the nurses, like what the last shift looked like, what they got in report. I review the chart, I do an exam, write a note, and then I write orders for the nurses. At some point during the day, a physician will come in because we don't have a physician in the hospital with us. We do our rounds. I give them an update on what the last 24 hours looked like, what my plans are, and they say yay or nay, add to that maybe sometimes. Once I'm done with that, they leave, go on about their day, and then I'm there for high-risk delivery. So I'd be the front line because there's no pediatrician or other physician for the baby. So anything that's considered high risk, so that could be a meconium, babies having heart rate drops during labor, and the OB and the nursing staff on the labor side are concerned, so I go. There's a whole list of diagnoses that I have to be present for, and then C-sections we have to attend. So we're kind of in-house for that. So it's sort of standby, on call for anything. And then we could also respond to the emergency room. If they have a patient brought in that's a newborn or under a year, then they often call for our assistant.
So would you say that like your day in the hospital, at this hospital where things aren't as high risk, looks different than it did when you were younger working at a busier hospital?
Oh, totally. Yeah.
Even as a practitioner there?
Yeah.
Okay.
Yeah, because the flow is the same, but on a much more complicated baby. I work 24-hour shifts.
Yeah.
A lot of facilities work 24-hour shifts. You can find the traditional nursing 12-hour shift. Typically that's going to be in your larger hospitals. Some of it depends on who you work for. But like where we are with 24-hour shifts, I say that to parents or whoever, they look at you like, whoa, how do you stay at?
Right. You're not.
No. So I just say it's similar to, I use firefighter as an example, where you come in, you have set things to do, and then your day is done, and most of my work is done in normal business hours, and then you're just on standby. You have to be present in the hospital, but you're not always working, and we have a call room so we can sleep. Sometimes I get more sleep at work than I do at home.
Opposed to like an RN in the NICU who's working a night shift is going to be awake the whole time.
That's right.
How often do you get to sit down, or are you on your feet all day?
Well, that depends too
on
which site you're at. At a larger site, it's considered level 3, level 4. Those units can have 50 to 60 babies. They can have a busy delivery service. You may not sit down very much at all during the day. Now, at a smaller hospital, community site, like where I primarily am at, it's much different. There are days that you can be moving because there's lots of deliveries that you're needed at, but the pace is much different. So we find we have more time to do like educational type of things, or like I work on unit statistics. We all kind of have something that we kind of interested in. So that there's work to be done. It may not be patient related, but there's other works. And then I have some administrative roles on top of my clinical, so it gives you time to work on some of that.
Do you ever wish you went to med school instead?
No.
I knew you were going to say that. Not at all.
No. And I've been asked that a lot, and I think it's completely different what we do at the bedside. We come to the patient in a different perspective. What you learn in nursing school on how you interact with the patient is completely different than what they're taught in medical school. And I think that there's so many factors, not only in the clinical setting, but outside the clinical setting, that I think are lifestyle factors.
What's your favorite part about your job?
Well, when you get to see them go home, just being able to share with families, sometimes my own experiences, like you.
Yeah.
So I think that I don't share my personal experiences in the NICU with everyone, but there are times you just get a sense of who the family you're talking with, that it's okay or it fits. When we see them come back, that's kind of the reward for us, because once you send them home, there are things you don't think about, or the impact of what we did in the hospital, how it may impact them down the road. I don't know if it's fortunate or not, but was able to see that with you and Dominic, things that I'm like, oh, words to describe it.
Mm-hmm.
So like if I just picked adjectives, well, I would say adrenaline.
Oh, okay.
Joy. I guess you would say stressful.
Do you spend much one-on-one time with babies, like feeding them, rocking them?
You would do more of that as an RN.
Okay.
Yeah, that's what some people that I know are NNPs have said. They miss that.
Oh, okay.
Because they don't get to do as much.
Do
you want me to show my cup?
Yeah.
I don't know if you can read it.
I don't know if it'll be in focus or not. What recommendations can you make to a student in nursing school that dreams of becoming an NNP in the future?
I would say that you need to be at the bedside for several years.
And I think that's important, because I see a lot of girls like on social media saying like, oh, I'm just going straight into my nurse practitioner from nursing school, and I don't know if you have feelings about that.
Oh, I have strong feelings about it. A lot of programs require like 2 years now in your specialty before you can be accepted into an advanced practice program.
Oh, okay.
But when I did mine, we had to have 5 years. So I think that's important, because you need to have a baseline, and you need to have, so especially in the NICU, you need to have been in a busy level 4, level 3, possibly level 4 NICU, and get that intense experience of a lot of patients, a lot of different situations. When I've worked for NNPs who are new and don't have a lot of bedside experience, haven't seen the same thing, and the same thing managed different ways, they get in this sort of robotic kind of framework where, oh, I saw X handled this way, so every time they see X, they're going to handle it the exact same way. Be able to think outside the box, not to be able to see the bigger picture, because there are more than one ways, more than one way to get to your end solution. Just because X presents doesn't mean that you are going to go down the same road every time and how you manage it. Also, I think you need to have a good handle on wellness. If you're going to be in the NICU, I think it's important to find somewhere you get exposure to well babies as well. Because if all you ever have known is sickness, a baby who is transitioning or adapting to being born can look sick. And if all you know is sick, then we will joke sometimes and say, some nurses will make babies sick. Then there are other nurses who are well seasoned who you want to transition your babies because they're going to cure them. They're going to get them over the hump. They're going to know this is transition. But it's because they've seen and done it over and over and over again.
That makes sense.
So somebody who, you're in nursing school, finish nursing school, seek out as much experience as you can in the NICU, but also remember to spend time learning what a well baby looks like. Because if you don't know what's normal, where do you go from there?
Right.
So somehow find a way to get exposed to well babies and then get exposed to the NICU world itself.
I plan on getting my degree in California where it's super competitive. Do you have any recommendations for things I could do to help me stand out?
If you're thinking about as advanced practice, the things that would make you stand out to get into the program is really probably going to be your references and your GPA. On your application that might make a difference are definitely going to be where do you come from. So are you coming out of level 4 unit from the University of San Francisco or San Diego Children or somewhere like that where you've had some really intense training and exposure as a bedside RN? Have you been on the transport team as an RN? Many hospitals have transport teams that are built by RNs. Teach NRP, neonatal resuscitation. That's something that's going above and beyond just doing your 12-hour shift. Teaching stable, which is another program that's sort of an adjunct in my mind to NRP. So those things to get into the program, and then once you're through a program, some of those same things will apply when you go to apply. Found myself over the years always looking for things that made myself more marketable and that I can do more so people want to keep you.
Do you ever feel like you wish you had chosen a different specialty?
Oh, never.
No. That's awesome. What made you choose this specialty? And then someone else asked basically the same question. How did you know you want to work with babies?
Well, from the beginning in nursing school, I knew I wanted to do something in pediatrics. I wasn't specific to NICU then. It was kind of just where I landed. So my first nursing job, I was a float nurse. So every day I went into the same hospital, but I went to a different unit. This was back in a time when we had the viewing nurseries where you could go in and see all the window.
Yeah.
And that particular unit, it was a big room divided into 4 rooms. And the first was the viewing nursery. Then they had an admission nursery because back in that time, you had your baby, we automatically brought it to the nursery, kept it for 2 hours, we did everything. The next 2 rooms were the NICU rooms. As a float, I could go into the newborn nursery and I could go into the transition and do those babies. So that was my initial exposure, and I just really liked that the more I was around it. And I still was floating out to peds floor, and so I still had some pediatric exposure mixed in with adults, but I just really liked that, so I was just kind of drawn from the float pool. I was hired into their NICU.
What is the hardest part about being an NNP? How do you move on from difficult situations?
Well, I don't know, I guess my personality has just been one that I've always left, for the most part, work at work. I've worked with nurses and nurse practitioners who have a really difficult time with that. It's a fine line. Everybody has to figure that out on their own, on where you draw the line. Because there are definitely families that I'll sit down and I'll talk with, and I may share the experiences with you and Dominic being born premature.
Do you have an example of a story where you felt blessed to work in the field that you do?
In some aspects, it was a blessing that I worked in that area before I had you and Dominic, because it gave me a different perspective. I'd like to think that I've impacted a lot of families in a positive way, calmed them, gave them some comfort during time that, as non-critical as we as caregivers might see a situation, to them it couldn't be any more disastrous than it is. I think to be able to, just bring...
What qualities do you think a person needs to have to pursue this career?
Patience.
Would you say nursing overall or specifically as a practitioner?
Patience, I would say overall.
Okay.
I would say, and this will be overall, a strong desire to want to help others. You need to be able to put aside bias. Hard sometimes, especially if you're in a community that serves a higher risk population. So I worked at University of Maryland for many years. That's a higher risk population. So you have to be able to put aside some bias and try not to become hardened to X always produces Y.
Yeah.
Or to generalize, stereotype, to be able to set that aside. You have to be prepared for long hours. You have to be prepared for holidays, weekends.
Yeah.
Non-traditional scheduling. There's always going to be ups and downs. There's going to be days when you're, working short. There's going to be days when you get called out because there aren't enough patients, and you might have to use your paid time off, your vacation time, whatever. There are all these seesaws of, it's just not a 9 to 5. I get paid every 2 weeks. But I think you're going to work hard, and knowing that that's okay, and you're there to help people and make a difference in their lives, I think it's incredibly rewarding. And in our world, typically 95% women come into the hospital pregnant, expecting everything to be positive.
Yeah.
It's all happy, it's all well, and then it goes south.
And the NICU is the one thing they don't want.
Right. I think just being prepared for all that, and that it's hard work.
Yeah.
It's hard work. For advanced practice, I think you take all of those same things, but I think in that role, you have to want to have autonomy. You have to be a leader. You have to have a voice, because you're going to stand up presenting and working side by side with a fellow. And as a nurse practitioner, we find ourselves, if you're in an institution that has a training system like that, a university hospital, a children's hospital, the nurse practitioner is typically aligned at that level. There's a lot of responsibility. Confident enough to make decisions and act autonomously, but not so confident that you don't hear your nurses. They're at the bedside. They're watching the baby every 3 hours or more often. Another fine line that you have to balance is enough confidence to present and to manage and direct, but also not so much that you don't hear what your nurses are saying, when you need to step back and really hear them. There are times when called to make an assessment, I don't see the same concerns they have. So we talk through why, okay, I think this is fine, and here's why I think it's fine. Does that make sense to you? Yes or no? We kind of walk through it, but it's a respect and a confidence in what I know that I know, but not so much that I'm going to ignore
what they're saying
and be overconfident and say, oh, well, I'm the nurse practitioner.
Was it hard or competitive for you to get where you are, both undergrad, masters, and now? Which, I guess you could talk about your whole process if you want to.
It's different than today. So when I applied to nursing school, we were in the midst of a major nursing crisis. It was competitive, but not like it is today. I could apply to my nursing school, be accepted, as long as I made the grades and wasn't failing out of a class to where that became a problem. Whereas your traditional programs today, you find yourself typically, your first 2 years or so, you're doing prereqs, you pre-accepted to the nursing program, but you don't know until you're halfway through.
Right, and some places you need a CNA and blah, blah, blah.
We didn't have those tests that we had to do before.
Those entrance exams.
Right. Okay. So that was different. And I went to a diploma school, which there are no more diploma schools.
Yeah.
They're very much what is now considered an associate's, basically a 3-year program. And I chose that route because it was very intense in its clinical exposure. And that particular program had a relationship with a 4-year college that I finished my 3 years. I was a nurse. I had a diploma, not an associate's degree. But I sat for my nursing exam.
Yeah.
And I could work as an RN, same licensure as a bachelor's prepared nurse. And then for 1 full calendar year, I could do this program while I was working and get my bachelor's. So that was the plan. And then your dad came along. And that was still the plan until we found out he was get shore duty in Hawaii.
In Hawaii was a lot more appealing
than
Missouri.
So we got married, and that's what Granny
Toward
called,
that.
like, if you get married and go, you have to finish school. What I did was I looked at programs, because we were in Hawaii, so I looked at programs at University of Missouri, figuring that was the Midwest.
Okay.
I looked at a program in California and one on the East Coast. And what I looked for was, what do they require for an RN to get your bachelor's or master's? Because that was, in the late 80s, they were just starting to have these programs where you could do RN to master's, RN to BSN. Those were really starting to come
show up as
into
bridge
play.
programs.
If I looked at 3 programs, I should be fairly safe. I did that. I took classes in Hawaii, and then we went to the East Coast. And we got there just when University of Maryland was starting their first RN to master's prepared neonatal nurse practitioner. And it was a little over 3 years. As far as competitiveness, I think it's just completely different today.
Yeah. Okay, how was NP school?
Stressful.
Did you work while in NP school?
I did. So I worked at a Kaiser clinic, and I did urgent care call center, and it was all pediatric. So you had that, and you had charting you had to do in relation to every phone call.
Okay.
But it was just an advice line, and I also did an RN in their urgent care clinic. So I just worked every weekend.
Did you get any certificates as an RN in the NICU before going for your NNP?
Those were all kind of new.
Okay, so you did.
So I did not pursue those. No.
Okay. How did you get a job as an RN in the NICU? Which you talked about, it kind of just happened.
Yeah.
Honestly.
Yeah.
You
And
just
it's, as a float nurse, they got to know me. I think that was my foot in the door.
Do you have any tips for getting into the NICU?
We didn't do practicum like you guys had the opportunity to choose an area of interest and spend so much of your clinical time there. That wasn't something we did. That's probably your first step. Can you get a practicum in an environment you'd want to work? They know you.
Yeah.
They're more likely to hire you if you perform well. So you have to constantly be on the money. You have to be asking the questions. You have to be not waiting for somebody to say, hey, go over there.
Right, you need to take opportunities for yourself. Yeah.
And find them.
How is your scope of practice different than an RN?
Oh, well, so my scope of practice is a lot. Yeah, I mean, the autonomy to admit, to discharge, to write the orders, to direct the plan of care.
Yeah.
I initiate and direct the plan of care. The bedside RN implements the plan of care. Now you may participate in that
and say, this is what I'm seeing.
Right.
Make a suggestion.
And can we do this?
Right.
You should definitely be critically thinking through the steps.
Right.
But it's not your role to create the
to say this is what we're doing.
Yeah.
What tips do you have for not getting emotional when a family breaks down after getting bad news?
I don't know that I can tell somebody how not to do it. It's just important to not do it. Half joke, half serious. But we'll say you do check your emotions at the door. And not to say that it's not okay, because every nurse has probably cried at some point. Those need to be a lot less than they are common. They're counting on you.
Yeah, you're
to
like kind of their backbone at that moment.
That's right.
Yeah.
That's right. And so you just have to put on that strong face. You have to check your emotions at the door to some degree, not completely, because that's part of what we do as nursing and as emotional support and being there.
Yeah.
But again, it's that fine line of not going over, stepping into their personal space too
and
much.
their emotions.
I don't have an answer to say how do you not. You just have to be, I think, self-aware. There needs to be emotion, but like somebody asked earlier, the roar to all that in the middle when it's not going great, most of the time you're going to get, at least in our world, I'm not speaking to adult ICU, but at least in our world, most of the time you're going to get them through that really crazy period, and you're going to send them home. Keep in mind that's the end goal.
Last one. What would your advice be for someone like me who is barely, not me, someone like me who is barely starting their journey in nursing?
I think just be prepared to take it one day at a time. You have to study, study, study. It's hard work. You have to do it. You can't do it because somebody else did it or somebody else wants you to do it, because it is hard.
Yeah.
School is hard, and the career itself is demanding. There's a lot of self-sacrifice. And again, it goes back to it's non-traditional.
And I think just being prepared for that and just know that that's what you're stepping into, and if you're comfortable and ready, that's what you want, then it's worth it.
And you will pay your dues in some respects in that you will probably do nights.
Oh yeah.
For a while. There is not this thinking that I'm going to graduate nursing school, I'm going to the unit I want, I'm doing straight days, I'm not doing weekends,
I'm not working holidays,
and I'm working as few holidays as possible. And I work with some RNs that's exactly where they are.
But no, it's true. Yeah, and I think you need to you can't go into it that way.
No.
That's not what the job is.
No. Yeah, because it's hard, and you have to want to do it. I went to school with people that they got out of nursing school and they fought tooth and nail to get through it because it was really, really, really hard, maybe more for them than some others. They're no longer nurses. And I know one NP, same thing. She never worked as an NP. It's hard work.
Alright guys, and just like that, the video is over. I really hope you guys enjoyed it. It was much longer than most of the videos on my channel because y'all sent in so many questions. I wanted to answer one more question that I forgot to answer in the interview, and that is, how did my mom working as a neonatal nurse practitioner, and how did that affect me? I think my mom's job is incredible. I think she does a great job. I think she is a wonderful nurse and a wonderful nurse practitioner in her field. She's been a neonatal nurse practitioner my entire life, so I've never known any different. She's always worked either night shift or 24-hour shifts. I don't think she really ever worked days unless she was like filling in for someone throughout my life. And so sometimes it was hard when she was gone. I obviously missed her when I was a kid, but now that I'm an adult, I recognize the sacrifice that she made, and that it wasn't like she enjoyed being away from me. Or my brother, or taking time away to be at work. Of course she would want to be home with us, so I definitely appreciate and value her sacrifice a lot more now that I'm older, and I think she's absolutely incredible. She's such an inspiration to me, and Mom, if you're watching this, I love you. You're the best. So yeah, I think that her job had a great impact on my life, obviously because I'm in nursing school. Me becoming a nurse is never anything we talked about ever, like throughout my entire life, my childhood, high school, college, like we never talked about it until I decided it was what I wanted to do on my own. My mom always felt like if I wanted to become a nurse, I needed to make that decision for myself. I needed to have the passion in my heart without her pushing me to do it. That's exactly what happened. My whole life, I never really thought I was going to be a nurse, and here I am. On my way to becoming one, so that is all because of her. I've watched her my entire life. When I was a really young kid, I would go with her to work sometimes, and that was great. Yeah, it's been great. I absolutely love her job. She's so inspiring to me, and I think she's the best. So yeah, Mom, like I said, if you're watching this, I love you so much. I'm so proud of you. You're an incredible woman. So I hope you guys enjoyed this video, and if you have any more questions, if your question wasn't answered, anything like that, leave a comment down below. If we come up with enough questions, we could always do a part 2 to this video. I hope you guys enjoyed it, and I'll see you in the next video. Bye guys.
All right.
Thanks. They're gonna appreciate it. I can edit it out, so it's fine.
Okay.
Oh, of course it is.
Then I tend to do.
I think that's Connor.